and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. In recent months, Mercy Malaysia has deployed emergency teams to two of the world's most pressing humanitarian crises. Gaza is teetering on the edge of an Israeli-made famine, with aid convoys blocked, hospitals destroyed, and orphan children starving. Meanwhile, in Myanmar, survivors of a 7.7 magnitude earthquake are still living in makeshift shelters, many without access to clean water, healthcare, or aid. This is a country that is already deeply fractured by civil war. Now, these two missions speak to the broader challenges aid agencies now face, operating in complex, high-risk environments where needs are rising but access is shrinking. So today on the show is Shah Fiesal Hussain, Head of Global Operations for Mercy Malaysia and Team Leader of SCT5, which stands for the 5th Specialised Care Team, and Mohd Radzi Jamaludin, who is an ex-official member of Mercy Malaysia. Welcome, gentlemen, to the show. Thank you so much for joining me here today.
Thank you, AWANI.
I'm curious to know about these missions. I want to learn all about your experiences and what you've observed while you were there. So maybe both of you can briefly tell me about your respective missions and what that entailed. Where did you go? When did you go? How did you come to be deployed? If I may begin with you, Shah.
Thank you. Thank you, AWANI, for having us today. Well, Mercy Malaysia SCT5 was deployed from 27th of March right up to 26th of April. So that's a solid 30 days that we were in Gaza. In fact, we were specifically up north of Gaza, Gaza City. 25 days in Al-Shifa, 4 days in Nasir Hospital down in Khan Yunis, and another day in the Kuwaiti Hospital in Rafah. So yeah, 30 days, solid. We went through a lot of memories, a lot of challenges, of course. What does SCT stands for? It's a specialized care team, which we went under the WHO EMTCC. So EMTCC stands for the Emergency Medical Team Coordination Center. Some of you are aware that Mercy Malaysia are a certified EMT Type 1 field hospital. We got our certification 2 years back, the first in the South Global that received this certification. With the EMT certification, we then applied ourselves during this Gaza crisis in 7 October to enter Gaza. So we got our approval on the 2nd of January 2024. So the first team was deployed 21st February 2024. Second team subsequently, third and fourth team, right until the closure of the Rafah crossing on the 8th of May 2024. So the fourth team was kind of stuck in during that escalation, and they left on 30th May. So ever since that, we have paused our mission into Gaza due to the safety and security. And this year, 2025, we decided to connected ourselves with the people of Gaza directly. So we applied again to go into Gaza, and this time we were assigned up north in Gaza, which is Gaza City and also North Gaza.
Sorry, Shah, you said applied to enter. So who did you apply to?
Yeah, we in short, I can't elaborate so much, but in short, we applied through WHO.
Okay, and assigned by WHO as well.
Yes.
Okay.
Applied through WHO EMTCC. Of course, they have got relevant phases and approvals, various levels that they need to get other permissions. But in short, it's just WHO MTCC. Yeah, so we were granted to enter on a convoy, which is deployed on the 27th of March. So EMTCC convoy moves in and out only on Tuesday and Thursday every week. Oh, wow. So ours was on Thursday. And what is interesting about this mission is that we actually got our approval very much earlier, on the 18th May and 20th May. But that was where the ceasefire agreement broke down.
Yes.
So we were anticipating that when we go in, it was supposed to be a calm non-conflict environment, a ceasefire kind of atmosphere situation. Not that we knew that when we arrived in Amman, a couple of days before that, we got to know that the ceasefire broke down and we are going again into a hostile situation. And I think right immediately 24 hours after the ceasefire, or even less than that, you know, the escalation happens. There were many bombings. You know, attacks has started immediately. So there was no. So there was also a call whether we should turn back, we should cancel the whole deployment. But I guess Mercy Malaysia and the team has decided, and we were very sure that we still want to go in. It's very crucial that we go in to assist the people in Gaza, especially during that crisis. During the SCT-1 to SCT-4, we were actually in a hostile situation at that time. There was no ceasefire, there was no understanding of this
but you went into it thinking it was under ceasefire
initially,
circumstances, yes. But it turned out that it was
Correct.
still under a hostile
Correct.
environment. How big is SCT-5?
There was only 4, myself plus another 3, one anesthesia, Dr. Sainira, and 2 dialysis specialists, 1 medical assistant, Azizul Hakim, and the other one is Nur Firdaus, a nurse, a male nurse.
Okay, all right. I'm going to come back to you and talk to you about your observations, but Radzi, talk to me about your mission and your deployment, so to speak.
Almost similar like, you know, what Shah mentioned. Okay, well, it is still pretty much on the same structure, the WHO, EMT and all that. The 2 major differences would be that for my mission, my team, we went in as this, what we call the rapid assessment team.
So you were deployed to Myanmar after the earthquake?
Yes.
Okay.
So we went in as part of this rapid assessment team, RAD, where our main duties was to establish our presence, to get buy-in, to understand the situation better, the stakeholders, which government agencies to work with, the community, the scale of the destruction, the pressing needs, especially our mandate will be on the medical. For me specifically, my task was to advocate and to push forward for the deployment of our EMT, emergency medical team. So Alhamdulillah, eventually we were accepted, not at full scale, but again, being an NGO, I think we Malaysians should be proud that we have this presence of our Malaysians there in Myanmar.
And how long was your initial assessment? How long did the RAT team go?
Initially was supposed to be 10 days, but due to we expected this to happen, the arrangement, the dynamic of situation, I stayed for 14 days, waiting for the next team to come in to do all the handover and stuff.
I see. So the team in Myanmar went in post-quake to assess the situation and the humanitarian needs. When you went into Gaza, what was your primary responsibilities? What was the objectives in your essentially what were you there to do for? Was it to distribute aid, to provide medical assistance? What was the objective?
Okay, when we applied to enter Gaza, so one of the many criteria on the team, on the composition of the team, is actually on the assignment of what assignment is given to us when we are on the ground, because we are actually a medical relief organization. So it's a purely medical response team. So we were at that time. Shifa just opened up. They were They were into the first week of their dialysis center. They just opened up a dialysis center. About there's 30 dialysis machines. So they wanted dialysis specialists, people who know how to run a dialysis center. Not so much on the doctor's level, but the technicians, the people who knows the machine, people who actually runs the machine with the patients. So yeah, so the dialysis was the ultimate, was the #1 assignment, and in all assignment into Gaza, Mercy Malaysia will also bring an NS, an anesthetist, ICU, because an anaesthetist and ICU specialist helps, in various field, from the emergency department right up to OTs, operation theatre and all that. So a single person or a group of these specialized people can do a multitasking job. So yeah, so we got Dr. Sainira, who's an NS slash ICU specialist. She's also a master in pain management and pain intervention. And during that period, 30 days, she was the only pain intervention specialist in the whole Gaza Strip. So she was sought after.
Wow.
I do not want to elaborate on pain intervention, pain management, but it involves blocks and specifics of pain management. So yeah, she was the expert.
Had the SCT5 members been in Gaza before? I'm sure you've been on other humanitarian missions before, but were you trained, prepared? Had you known what to expect?
Very good question. This is one of the things that we also want to share as an awareness, not only to the Malaysians, but also to the local agencies. So yes, the Dr. Sainira, Hakim, and also Firdaus, it was their first time, first mission into Gaza. In fact, their first mission overseas, except for Sainira, have gone to Afghanistan before this. For myself, this is my second deployment into Gaza. I was with SCT3 way back in April 14 until 1st May.
Oh, so about a year ago,
yes,
you were in Gaza.
Yes, so I was in SCT3. Again, I entered with SCT5. Throughout my 13 years of humanitarian work, this is my third time. I was there in second Ramadan 2014, way back. That's 10 years ago. So yeah, and of course I've gone various missions, conflicts and all that. So nothing new to me, but yeah, as a team leader, it's not so much on myself, but also the team members. I think the priority was a team member, and yes, so that was the ultimate. And of course, Mercy Malaysia has conducted basic mission training, or we call it BMT. We have done this 20 years with the PGA, Pasukan Gerak Am, or the General Forces, GOF, based in Ulu Kinta. So we have been with them, God knows.
Oh, so Mercy Malaysia trains you in preparation for being deployed. So it's not like just before you get deployed, you go for training.
No.
This is a consistently.
Yes.
This is consistent
for
training
international mission, you must have BMT, you must have the EMT, you must have a couple certification before you can go for international mission.
Okay.
So there's a criteria to it. Right. So for Gaza itself, there's also a pre-mission training. So 1 week before that, at that time it was fasting month, Ramadan. No choice, we went for pre-mission training specifically to do simulation on what we expect to happen in Gaza. So PGA again came in, we got them.
How do you train for?
Oh, with all the bombings and all that. It was if you could ask the 3 volunteers, that pre-mission training 1 week before in Uluyam helps them a lot in terms of preparing them to what are the expectations. I think the PGA had used, again, I cannot elaborate, but the gunshots, the weapons that they use, the bombs. So it's almost 90% as good as what we're going to hear.
Right.
Of course, we don't hear the F-16 bombing and the drone bombing and all that.
But did anything prepare you mentally and emotionally for what the actual reality
was?
So
the physical part and also the physical and the mentally part is being prepared throughout the pre-mission. We have also got MIASA. MIASA. MIASA is an organization that does psychosocial support. So thank you to MIASA for being with us throughout the 30 days. They have been on our side, of course, on a long distance. They check in on us every morning to see whether we are stable in terms of our psychosocial metrics and all that. But even before that, there's a couple of sessions with them in terms of how to maintain our mental health, and
Yeah.
also.
I'm glad that there
Yeah.
was support provided in
Yes,
terms of such,
we actually look at all angles in terms of preparing
fantastic.
the team.
Radzi, so your deployment, as we were talking about training, maybe it was under emergency circumstances. You'll never know when you need to be deployed, right? It's an emergency. You have to go. How quickly were you able to enter Myanmar to assess the situation after the quake, and what did you see? What challenges did you have going in?
Well, we were ready to go in to go in much earlier,
Okay.
but due to the nature of having to apply for visa and all that, we managed to get in on 5th of April.
This
Now,
was during Raya.
Yes.
Right? Okay.
but I guess the biggest strength, the biggest advantage that Mercy Malaysia had was that we have been in Myanmar since 2008.
That's right. Yes.
So we
you
have
established a presence there already.
Yes, and we have local staff. And I would like to take this opportunity to pay a huge tribute to the team there, especially Dr. Sai, for being very, very helpful, resourceful, and helping us for us, the red team, to get to the objective of the mission.
Okay. Which was to assess the situation on the ground.
To assess the situation, to establish the needs, to establish the resources, and eventually to communicate back to KL. Based on all, the biggest challenge with this red team is it always be to get the acceptance of the host government. I guess set aside the distraction, all that, the biggest challenge will always be in any countries is to allow the host government to give us the platform to come in and help. So having a good relationship, again and again having this very strong, very resourceful local staff help us a lot.
What challenges though did you face? I'm glad to hear that there were very helpful people who helped pave the way for you, but I'm sure that mission must not have been easy. Even it's civil war for many years.
Yep.
It has just been through a devastating earthquake. So many people displaced. What challenges did you face?
Well, interestingly, for that 2 weeks, I think we covered nearly 2,000 kilometers of traveling.
Wow. Just in terms of sheer geographical location.
From Yangon to Mandalay, where the major damages, and then from Mandalay to Naypyidaw, the capital city.
It's central Myanmar, right?
Yes.
Okay.
And then from Naypyidaw back to Yangon. All that for different reasons. So the challenges is basically to connect the dots. When you see this, when we see this, how do we connect to this? Of course, we have to be respectful to the government. Fair enough, even for us in Malaysia, sometimes the government staff themselves are the victims of the disasters. I mean, similar to us when we have all the big flood. So trying to be understanding as much as we can. To one of the districts that we went to, the district office work under tent. The whole office work under the normal tent, and they work 7 days a week, from 8 in the morning until 10 in the evening. Very highly dedicated, and they welcome us. They welcome us.
Okay.
So those are the things that make you feel more grateful.
We have a lot of news coverage about Gaza. There's a lot of information on social media as well, but with Myanmar, less so.
Less so.
Less so.
We have to respect whatever the prevailing laws in Myanmar when it comes to reporting, but we always want to portray the best part. The best part is the people there, all the people that we met, very determined, good nature, helpful, smiling, they fight on all the challenges and all that.
Radzi, what was your assessment of the scale of the humanitarian need there?
It differs from places to places.
Okay. Where was the worst?
When we go to Mandalay, it's pretty much a city type. Access to clean water may not as difficult to the villages and all that. So that's the challenge for RIT, to be very objective, not to put everything in one basket.
I've noticed that to be part of a Mercy Malaysia mission, you have to be really level-headed and clear thinking in situations where most people will panic and and kind of lose the control of emotions. Talk to me a little bit about that, what you learned about yourself and about the service and your work while you are on the field under hostile conditions and working with, you know, observing the very, you know, heartbreaking situation, which I'm sure you both, I would love to hear from the both of you. Shah first.
Well, again, it goes back to being composed, calm, you know.
You can't lose your composure.
Well, I mean, if I take myself, probably there's nothing challenge about it, because, you know, I've gone to many missions, but ultimately it's not me, it's a team. Being a team leader and also you know, somebody representing Mercy Malaysia itself. My challenge or my priority was on the team members.
So you were there to essentially ensure your team was able to carry out their responsibilities, their duties.
That's one. I also have other TOR, other term of reference, which you know, I do engagement. I also do other. I also carry out projects. God knows, I think we did about 20 projects down. The non-medical projects we did, from sewage to road access to solar panel, clean water, NFI. During the first Shawwal, there was a Baju Raya kind of gift to the children. This is a psychosocial, it's a child-friendly space. So yeah, I did all those.
You were there during Eid, the first day of Raya?
No, we were there during Ramadan.
Okay.
So 27 was actually a couple of days before.
Okay.
So when we entered, I can still remember when on the first day that we arrived in Khan Yunis. I can't tell you which entry point that we came in. That's a bit of not to be shared, but
okay.
Whatever point that we enter, we were put one night before we move up north. And I'm sure you know, up north you got to go through the Zarim corridor, which is being managed and also being managed by a certain group of people. So that's also another challenge. From Khan Yunis, Dabala, Rafah, going up to north, you need to go through that another process, you know. But that's via the UN convoy.
May I ask both of you, I think you've alluded to the fact that some information is sensitive and must remain confidential.
Yeah,
why is that?
Okay, I'm sorry, it's not as sensitive as it is. It's just that a certain protocol, certain...
that you don't disclose your route or what the plan is. I understand.
That's part of the process, and you know, there's many parties involved, so we don't want to get ourselves in a certain situation. Yeah, so it's a salient point. It's something that we just want to keep quiet about it.
Okay.
Yeah. So anyway, it's an entry point. So yeah, coming back to the question, composure.
Yeah. What did you observe? What did you learn about yourself?
Prior to the mission, during the pre-mission training and all that, so there's you know, this esprit de corps, teamwork, one team, follow the leader, listen to the leader, all this kind of thing. So the boys and girls or the team members who were with me, they were very good. They were awesome. They were, you know, I give so much respect to them. It's always about listening. It's always about taking instructions. It's not taking instructions boldly, but taking instructions knowing that the team leader is calm, so they should be calm. Because we hear 20 bombings a day.
Wow.
You know, we get helicopter going down with machine guns all running. We hear 1,001 things.
Were you ever in danger?
And the best part that all these things happen mostly during Maghrib, late evening, early evening, right up to the next morning subuh.
Oh, at night.
So that at night, because movement happens at night for whatever reason. Okay, let's go to detail. So things happen during the night, and those are the period that you're gonna have lunch, you're gonna have dinner, and then you're gonna sleep, you're gonna rest, you're gonna take a bath. Imagine you are bathing and then suddenly, you know, you have all these things and you are in the bathroom running helter-skelter, you try to save yourself. So all these things is being taken into consideration. So when someone takes bath, we are prepared to, the clothes are already, you just come out from the bathroom, jump into your clothes and start to do whatever protocol that you need to do. But again, it's all about calmness, it's about assessment, it's about ground information, it's about networking. Can we get information, early information prior to whatever escalation is going to happen. We get information on the ground from our sources whether this is going to happen. The Gazans or the people of Gaza themselves, they have got some mechanics of a process that's on the ground that things is going to happen. They kind of know way before, a couple of hours, at least minimum half an hour before. Okay. So that they're able to run, they're able to move, they're able to hide themselves. So all this information we need to get also, because we are also part of them.
You have to tap into
Correct,
the whispers in the wind.
So this is then being processed, and this is where we, I will have to guide the team to, not to be panic, not to rush into things, and we sleep. If it is time to sleep, we just sleep. If it happens, it happens. We kind of after 1 week, the second week, we kind of not bothered about it because it is going to happen anyway. Okay. And we trust the process so much that we are confident that the hostel, the place that we are staying, and also the hospital that we are working, is not going to be affected. That's how high confident we were, because of the process of the coordination with the UN and various parties. And I'm sure you are aware that Al Shifa yesterday was asked to evacuate that block. I think there have been attacks to Al Shifa. Unfortunately, patients have been moved out from Al Shifa. That is the hospital that has been working for 25 days. So when we saw that yesterday, what's happening to Al Shifa, we were a bit disappointed, and we were wondering, imagine if we were there when we were working. So again, you can see that they have been warned to move the patients out. They have been warned that the attack is going to happen, those kind of things. Okay. Yeah. All
right, Radzi, if I may ask you, during your mission and previous missions, I'm sure, how has that changed you? What have you observed?
This is one important learning that I carried out throughout my mission. Yeah. There was this leadership course that I went to, facilitated by, of all people, the Pascal. Of all people. Wow. So it was a 10 days course. We slept, for 6-7 hours throughout the 10 days. But these 3A that they taught us, that I always carry with me whenever I will go for mission. Accept, adjust, adapt. As simple as that. For Myanmar, to accept that this is the mission, this is the sort of risk that we will go through. We have the small tremors and all that. Adjust, of course, to
be flexible.
Just to adjust, basically not to have your normal routine. Okay. For mission like this earthquake, I've even said this to our mission members. Be prepared to run, but not in your underwear. In case we have this thing happen.
Oh dear.
So whatever that we do 24 hours a day is always a matter of be prepared to run.
Be prepared. Be
prepared.
Okay. So be vigilant.
Having your shoes ready.
Oh, so that's what you said about jumping into the clothes as immediately as possible. Don't be vulnerable.
And then to adapt, make it your routine. The whole idea is that be comfortable, being uncomfortable.
Okay. Well, gentlemen, thank you so much for sharing your experiences. It's been eye-opening to talk to you both, and thank you so much for your service. On behalf of Malaysia as well, thank you.
Thank you so much.
That's all we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and thank you.